Thank you. This is Katie Boyd from Senator Blunt's office. We are going to start the call with a few opening comments from Senator Blunt, and then we will open it up to questions. And with that, we will get started.
Well, thank you, Katie, and thank all of you for joining today. A little bit of a heads up on next week. We'll have a hearing on Thursday in the Labor, Education, Health and Human Services Subcommittee that I chair, and that really will focus on what we're doing with testing and what we're doing with vaccines. We'll have Dr. Collins from NIH. We'll have the person who's now running BARDA, that organization that was set up about a decade ago to be a partner with private sector efforts when you're doing something like we're going to be doing with vaccines and tests. You want to move that forward quickly. There's only likely to be, maybe in some of these cases, one customer, the United States government, and what kind of agreement you make early with them. And then Dr. Redfield from the Center for Disease Control talking about, among other things, the importance of flu vaccine this year. You certainly don't want to get in a second wave of COVID and have the flu if you could avoid it. And also the distribution of vaccines. I think right under developing a vaccine, being sure that we have a plan to fairly and quickly get that vaccine across the country will make a big difference in that regard. And so we're going to be talking about that. On the testing and the BARDA, the warp speed concept, Senator Alexander and I, in the last CARES bill, the update of CARES, put a package in there. We called it Shark Tank, for the NIH to accept proposals on testing. We need more tests. They need to be quicker and more easily taken. And tests that can be taken by millions of kids going back to college and university campuses and other public and other schools, as well as people going to the workplace, that in a workplace where you want to have testing. The idea there is to quickly zero in with that Shark Tank kind of environment with, I think they put together about 100 people to look at the various proposals and decide which 5, 10, 12, 15 are most likely to be successful, and make a little government investment in them that allows them to move forward. On the vaccine front, same principle exactly. It's called warp speed over there. And on the vaccine front, I think the administration will soon be announcing 6 or 7 vaccines that they think are likely to get through the entire process of FDA certification and begin to move on sort of a dual track. One is the certification track. That's what it's always been. There's no risk in the certification track. It'd go through what any other vaccine would have ever gone through, but then you'd have a parallel track to where, with vaccines that we think are more likely than not to be successful, doesn't mean 100% sure, but more likely than not, to go ahead and begin producing those vaccines. At the end of that path, let's say you chose 6 of them and 3 of them were successful and 3 of them weren't. The 3 that weren't successful, we would just buy and discard those vaccines. But why would you do that? So that the 3 that were successful would be available, say, January 1 rather than April 1. And whatever the federal government invested that had to be discarded would be well worth it if it gets us to the safer point in the vaccine and the better point for our economy quicker. And so occasionally, Dr. Fauci and others have said we're willing to accept some risk here. The risk is not risk in the vaccine. The risk is the risk of losing money if we produced a vaccine that maybe made it 70% or 90% of the way through the certification process, but just couldn't get the 100% absolute certainty that we're going to need with the vaccines that we make available. And so we'll be talking about that next week. I've been talking about this for months now, trying to be sure that we have the money in the right place and the commitment in the right place on testing, on therapeutics, and ultimately the vaccine is what lets us move on with the economy at the way we'd want to, and also encourages people to re-engage societally the way we'd want to. So that'll be next week. I could answer any questions about that if you want. But Katie, I think I'm ready to go to questions if you are.
Wonderful. We will now open things up for Q&A. Please state your name and outlet. We ask that you stick with one question until we get through the first round, and we'll be happy to take additional questions at the end if we have time. Go ahead with your first question.
This is Jack Miles with the Richmond News. How
Hey,
well
Jack,
prepared
how are
is
you?
the federal? Hey, I'm doing all right.
Good,
Thanks for
good.
doing this, by the way. It's always appreciated. How well prepared is the federal government with equipment, masks, et cetera, if the death toll mounts commensurately with the number of COVID cases that we now see apparently returning to the country?
Well, I think we're prepared. I think we have the equipment. I think it's unlikely that the death toll will have any commensurate comparison to the death toll earlier, where people that were being tested were almost universally people that were already sick. Now you're having lots of tests and lots of results, but many of those results are people who are asymptomatic, who are young, healthy, unlikely to have, one, been assigned a test by a doctor, and two, to be affected in a dramatic way by the disease if they got it. So we'll see. You know, the president's right when he says more testing means you're going to have more cases, but I think we've got to have more testing. We have to have more testing for all the college and university presidents I've talked to, and Senator Alexander and I have talked to together to feel good, and for moms and dads to feel good about kids going back to a campus living environment. More testing for anybody that shows up at school that has a problem at elementary and secondary schools as well, and more testing for people in whatever workplace they believe and their employer believes a test is essential. And you know, we've seen that particularly in the close workplace situations we have in livestock and poultry processing facilities in our state and other places. But there are going to be other employers that want to have more tests. I talked to a person yesterday who runs one of these companies that actually produces tests, and he's trying to figure out how their thousands of employees all over the world can be tested at least once a week. And other people will want to do that until the vaccine moves us beyond where we are now.
Hi, Senator. This is Jason at the News Press in St. Joseph.
Ken? Mm-hmm.
Yeah.
Yeah, I was wondering if there's any change in the state of the Senator Scott's bill. Is that just, are there talks underway, or is that just dead, or where does that stand?
Yeah, I think I do a lot of these calls and things like this now. If everybody's not talking, could hit your mute button. That seems to eliminate the echo that was in that question, which I heard, but there was an echo there. The Scott bill doesn't have to be dead. The majority leader changed his vote so he would be on the prevailing side, which means it could be called up anytime we believe there was a reason to call it up. I think the Scott bill was an example of a problem that the country absolutely wants to solve, understands in deeper ways than we have before, and is supportive of the government taking action. Senator Scott's bill was a bill I co-sponsored. I think it would have been a great bill, certainly a great place to start. I said on the floor yesterday, we've lost that element of being willing to vote on amendments. Senator Scott, Senator McConnell agreed to, I'm told, 20 different amendments with a manager's amendment that could be negotiated even without votes. There's not that much difference in the House bill and the Senate bill. You hear some differences described. Normally, the differences aren't real. They say, well, there's no no-knock warrant in the House bill. Well, there's a no-knock warrant in the Senate bill as well for some federal officials or federal law enforcement. And that's the same thing in the House bill when you look at it, but nobody is explaining it quite that way. There was a time not too long ago in the Congress when you frequently heard this comment, I'm going to vote for this bill so it can go to conference, and I hope it gets to be better in conference. The Speaker said last week she was willing to take the House bill to conference. Well, to go to conference, you've got to have a Senate bill, and to have a Senate bill, you've got to be willing to debate it. And I think it was incredibly unfortunate that we weren't allowed to move to that bill to debate. You don't have to vote for it at the end of the debate. That's a 60-vote threshold as well. And even if you do vote for it at the end of the debate, you don't have to vote for it when it comes back to conference if it hasn't been approved the way you think it should have been approved. Everybody appears to have forgotten the civics lesson of how you pass legislation, thinking it's take it or leave it. The House comes in for one day. I think they're doing that today. They'll pass a bill today, a process totally unsatisfactory. They'll send us that bill, and then our friends on the other side will say it's either the House bill or no bill at all. That's not the way this process is supposed to reach consensus and compromise, and I think we should have moved forward with the Tim Scott bill. He was incredibly knowledgeable about this issue as an African-American man who's been stopped many times growing up and even as a United States Senator. I think he brought a good product to the floor, had a good team of members working with him on that. It wasn't perfect, I'm sure. I've never voted for a perfect bill and don't expect to, but it was a great start to have the discussion to get to the best possible bill we could do right now. And we failed to do that. And I'm glad we had a few Democrats join all the Republicans to go to the bill, but we didn't get that 60-vote threshold that was necessary to move to a bill in the Senate.
This is the Washington Control Room. As a courtesy, if you're listening through a speaker and your phone, can you please press pound 5 to mute your phone and kill the echo we're getting for everybody? Thank you.
Okay, who's next?
This is Summer Ballantyne from the Associated Press.
Yes, Summer.
I saw that the ACLU had filed a lawsuit against you for removing comments from your Facebook page and other social media outlets. So I first wanted to ask for your response to that, and second, just wanted to see what your policy is for moderating or removing comments on your social media.
You know, I don't think we have a policy that would do that unless there's some language that is so offensive that it shouldn't be on the page. I'm not an expert on this. I know my staff checked yesterday, and that individual has had many things posted that were far more aggressive and negative than the example of what wasn't posted. I don't understand enough about Facebook's monitoring process or any of that to really comment on it, but certainly it's not our policy. And if you look at the comments, as you'll be able to at some point in the future, that we've given to our attorney that were posted by this individual, there's clearly not an individual bias or a desire to take off his comments that are very negative, because they were much more negative than the comment that apparently didn't get on the Facebook page, and I have no idea why it didn't get on. But it's probably an issue that's good to clarify, and look forward to working to a conclusion on that.
Could everyone hit pound 5 if you are not asking a question? That will mute your line. You can unmute your line with pound 5, but that will eliminate the echo, please. Thank you.
Hi, Senator Brian Lowry, the Kansas City Star. Just wanted to ask you about coronavirus relief going forward. The increased unemployment benefits run out next month, and as you're aware, Missouri and other states have had to seriously cut their budgets in the face of the revenue shortfalls. Do you foresee an extension of the unemployment benefits, and is there still a discussion going on about relief for state budgets?
Well, there are two big questions, Brian, and I think we're trying to put all of those facts together right now. I frankly believe we're very much on the right time frame track here of moving from what was a rescue phase in March, trying to quickly jump in, do what we could to stabilize the economy, understand that it wasn't all going to be perfect, but it needed to be quick, and it was. It was quick, wasn't perfect, but actually closer to the mark in most cases than you might have expected, based on the fact that nobody has ever seen anything like this health impact on the economy. We do know that there were no fundamental problems with the economy going in, and so in many ways, every way you'd measure it, was the best economy we've had in at least 50 years, and you might even argue more than that. So it's not like 2008, it's not like the 1929, it's not like any of that. So how quickly do you restore participation in the economy and health at the same time? We've always been in two fights here. One's the fight against the virus, the other's the fight for the economy. And what we're doing now is trying to look at the statistics. Obviously, the job creation numbers were surprisingly positive last month. The retail sales numbers were even a bigger surprise, I think, to people. And trying to figure out now how we impact the economy and look at those businesses and those jobs and those individuals that were the most harmed by what happened. 40% of everybody who made under $40,000 went from work to unemployment. So clearly you've got a group there. How do we specifically impact that? The travel industry, from restaurants to theaters to airplanes to motor coaches, obviously dramatically affected. Some people in the food sector, much more dramatically affected. If you were a food provider to restaurants, for instance, and hospitality, than if you were somebody whose business was focused on getting food to grocery stores. So we're just trying to figure all of that out. I'm not sure how the federal unemployment addition will work itself out. I do know that in most states you have to make at least $56,000 or so, certainly over $50,000. Let's just be safe here. When you were working, to be making more working than you were making on unemployment. I don't think anybody thinks there's logic to that. But how do you deal with this? Do you deal with it differently in states that have been more negatively impacted than others? And so we're looking at those options. We will put a bill together in the last half of July. We've spent about half the money that's been appropriated so far. We'll spend more than of the remainder between now and the middle of July, but there's still plenty of money going out, and we need to figure out what to do as we move from rescue to recovery. And certainly the right things to have done for April and May are not necessarily the right things you would do for August, September, October, and so I think our timing is good. I'm comfortable with that. And I'm also comfortable with not making any quick decisions about what any of that needs to look like when we put it together a month from now.
Hi, Senator. This is Philip Sitter with the Jefferson City News Tribune.
Mm-hmm.
What are your thoughts about the likelihood of more stimulus for higher education at this point? The testing you mentioned might help, but it seems likely that schools will face some kind of tuition hit in the fall.
I think that's right. And, I'll chair the committee that puts together that part of the bill, the health part of the bill, the education part of the bill, the labor part of the bill. I think with some certainty there will be more money for education, elementary and secondary and higher. There'll be more money for healthcare providers, particularly hospitals, trying to figure out how to focus that in a way that makes the most sense. Children's hospitals, rural hospitals have different concerns than others. And there'll be more money for testing, there'll be more money for vaccines, there'll be more money for therapeutics, and education will be one of the areas where I think we know it's critically important to return to a more normal environment for families and the economy if people are able to go back to school. And back to school means a different thing this fall than it would have meant last fall. And I think the federal government will include money that will help defray a substantial amount of those unanticipated COVID-related costs. Probably have time for one or two more if anybody has a question.
Senator Blunt, this is Brent Martin with KFPQ in St. Joseph.
Mm-hmm.
In your talks with some of the health officials, where do you think we stand right now with much of the economy opening? We've seen cases rise, but where do you think we stand with COVID-19?
Well, I think we're seeing a plateau and then a downturn most places, certainly in the places that had the big outbreaks earlier. I think there'll be a second wave. From all the discussions I'm in, and I'm in a lot of these discussions based on all the agencies that we're constantly working with that I'm responsible for the funding for and some of the directions to how that money is spent. So I've been on literally hundreds of calls with scientists, healthcare providers, people who are running these agencies. I think they all think there'll be a second wave. I do too. And probably occurs late October, sometime in November. Schools are trying to figure this out with their school calendars. More tests will help send people home that otherwise would be exposing the illness they have to others. That's why easily taken, frequent tests make a difference. Obviously, a vaccine helps. I think we're on track that we might have substantial numbers of vaccine available by January 1. If that's true, and the second wave would not hit until, say, Thanksgiving, we just have to manage through until January 1. And then again, very important that we have vaccines quickly and fairly available. Vaccines shouldn't just be available to people who could either pay for them or drive to them or fly to get one. And that's one of the things we're going to talk about with Dr. Redfield next week is what we do to make that available when we have it, and also talking to Dr. Collins about our plan to make tests available that can quickly, if you're on a college campus, for instance, you take the test, it's your time to take the test, or you have a little bit of a fever, and within minutes we need a response that, no, you've got a little fever today, but it's not COVID-19. We have no reason to think you're contagious. You go right on to class. Or, yes, you do have COVID-19. That's why we've set aside the dorm where you'll have an individual room, the ability to take your class remotely, and you need to go there right now. And that's the kind of wearing that mask, thinking about social distancing, having tests and therapeutics, and eventually a vaccine is what moves us through this. And I hope we have the discipline as a society to do the right thing, and I believe we will.
Senator, this is Jack Miles.
Jack, I think you got the first question and you get the last one. How's that?
Yeah.
Well, I hope it's a good one then. If the House and Senate police bills are not much different, then will the House bill have much of a chance when it gets to the Senate?
Well, I think the House bill will be different enough that the Senate deserves to have a Senate bill. You know, this idea that your only option is to pass the House bill is just not a reasonable option. You know, I think we still could go back to our own product, our own Senate bill, put together, I think, very effectively and explained very effectively by Senator Scott from South Carolina, and amend that bill as you would need to if we really want to legislate. There are so many issues, Jack, to where our friends on the other side in an election year, I think, would rather have the issue than the solution. We could have said that, proven that wasn't true this week by beginning to work toward a solution rather than say, no, we're just not going to take up the bill that the majority offers. And the majority in the Senate should have the opportunity to offer the base bill. Certainly that'd be the case if the Democrats were in the majority in the Senate, and they know it. So thank you all for letting me be with you today, and let's see how this all works out in terms of the quality of what you've got technically, and if there's a better way to do this, we'll try to find a better way. Thank all of you.